Hello, I'm Dr. Sanjay Panicker. Hairs and nails are the only thing in the body which can grow back again. You cut your nail, it grows back. Cut your hair, it grows back. Hair falls, it grows back. A nail can be removed, it again comes back. So, this is something in your body which has the capacity to regenerate. Hair has got a life cycle. Usually, it grows, it maintains for some time, and then it falls off. So there's a growing phase, there's a maintenance phase, and there's a falling phase. The lifespan of a hair ranges between 2 to 7 years. There are some people who have a shorter lifespan of the hair, some people who have a longer lifespan of the hair. Now you have seen that certain women have very long hair, even up to the ankles. That is because the lifespan of the hair is very long for them. Whereas some people, they cannot grow their hair beyond this length, maximum 12 inches. That is because the hair is growing. Hair grows at the rate of ½ inch every month. So if it has to grow 12 inches, it's going to take 24 months, that is 2 years. So there are some people with a shorter lifespan like 2 years, and they can't grow the hair beyond this. Now the length of the hair is determined genetically. There are some people who have shorter hair, some people have very longer hair. That's a gene which is responsible for it. So when the hair grows, it has to fall at some point. It cannot keep on growing. It finishes its life, it falls off. And it just doesn't fall off like that. When a new hair comes, it pushes the old hair out of the socket and then it falls out. That socket is what we call as the root. Now the root is always there in the skin. It never falls off. The root is always there. And in that there is a bulb. The bulb of the hair. Then comes the shaft of the hair. Now this bulb is what comes off. So what you see, that white tip at the base of the hair is actually the bulb of the hair. When that bulb comes off, a new bulb is formed, and from that a new shaft is created, and then it grows. So when this hair is growing, it pushes out the old hair, and that's how the hair falls off. So it is not that the hair is just like that falling off. Of course, how do you know whether your hair which you are seeing on the pillow is within the normal range or is it out of range? Losing 50 to 100 hairs per day is also considered to be normal. If you are losing more than 100 hair, 150 hair, then you have to think what is the reason behind it. Losing up to 150 hair also at the time of wash is okay. Because most of the people have this fear that if they wash their hair will fall off, and so they don't want to wash their hair at all. So don't have to get into that phase of worry. When you are losing hair, the body has the capacity to regrow it also. So even if you wash your hair on a daily basis, actually that helps to improve the circulation to the hair. When you wash your hair and then dry your hair, the circulation to the hair improves. So the nutrition to the hair improves, the hair retains longer. The hair which has to fall will anyway fall. 700 hairs per week is anyway going to fall, whether you wash, you don't wash, do whatever it is. If you wash only once in a week, you're going to lose 700 hair altogether. You may get very worried. The hair loss actually gets divided among the days when you wash it on a regular basis. And finding a few hair on the pillow, don't worry. There is a test by which you can assess whether your loss is within the range or out of range. All you need to do is just run your fingers through your hair, hold a tuft of hair like this and give a steady pull. If you get more than 5 hairs per pull, then the loss is out of range. More than 5 in every pull from every area, or from at least 1 or 2 areas or 2 or 3 areas, then your loss is out of range. This is for men. For women, you need to hold a tuft of hair between your thumb and your forefinger. Hold a tuft of hair and give a steady pull like this. Don't hold here when you do this pull, because then you are giving that support here. Let the pressure come onto your roots. Hold it here and then pull it steadily. And if you get more than 5 hairs per pull from different areas, that means you are losing out of range. Your loss is out of range. So this is how you can do a self-assessment test. In case you are not able to do, meet a good trichologist nearby, a good doctor who can deal with these hair conditions. Yes, there are excellent remedies in homeopathy which can help you to control your hair loss. And if you are losing hair very fast, now you would identify what is the cause behind this. What is the type of hair loss that you are experiencing? There are 40 different types of hair loss. Now, what is your type of hair loss? Most often what we get in patients is the androgenic alopecia. Androgen means male hormone. Androgenic alopecia means generated by the male hormone. Now this male hormone is there in me, it's there in you also, it's there in males, it's also there in women. Now the quantity of male hormone in women may be less, but if your skin is oversensitive to that particular little quantity of hormone, then they may lose hair. What this hormone does, it goes and blocks the root of the hair in the form of DHT, dihydroxytestosterone. It goes and blocks the root of the hair, so the nutrition what the hair is supposed to get, it doesn't get. If hair doesn't get the nutrition, then a thick hair falls, no nutrition, so it grows back as a thinner hair. The hair which is coming is what is pushing the old hair. Now when it is pushing, if there is not enough nutrition, the hair which is growing grows thinner. So every time a thick hair falls and a thin hair grows, that thin hair falls, thinner hair grows, gradually the volume starts going down. This is one common condition, androgenic alopecia, where in men we call it as a male pattern of baldness. In a particular pattern they go worse, where the sides go deep, patch forms here and patch becomes bigger and bigger. Now this androgenic alopecia, in women it happens in a different pattern, where they undergo this partition widening. Also for them also a little bit of testosterone is there, so sides also get thinned out in women also. And whether it is male or female, if the skin becomes less sensitive to that hormone in the body, then that condition can be tackled. That can be done with homeopathic medicines. For that we'll have to understand the personality type of the person, the stress levels, the body nature, what all health issues they have, and tackle it holistically with the correct constitutional medicine. Then it will stabilize. Now if it is an acute hair loss which is of a recent origin, let's say you had a fever and then you had a hair loss subsequent to that, that's called telogen effluvium. That's another type of hair loss, and in that condition there are medicines like maybe thallium, there are medicines like jaborandi, there are medicines like natrium, there are medicines like China, which may help, carbo-veg, which can help to regulate that hair loss. Now it depends upon the cause that we will be treating conditions. We'll be treating this hair loss issues. Now there is also hair loss which can happen due to various other conditions like autoimmune conditions. So the presentation is different. As I told you, there are 40 different types of hair loss. There can be, in general, hair loss can be called as alopecia. But is the alopecia diffuse throughout the scalp, or is it in patches, or is it in a particular pattern? All that we have to observe when we treat it. And then when we treat it based on the right kind of medicine that we use, we can improve the condition. Now for example, weak roots is one of the symptoms that is there in Staphylococcus aureus. But in Staphylococcus aureus, the emotional factors also contribute to the hair loss. Now a patient who has experienced extreme insulting situations and is not being able to express that feeling outside, so this impacts the mind so much that there are changes inside the body, which in turn makes the scalp so sensitive to certain things in your own body or deficit of nutrients, and then the hair falls off. So that can also happen. So there are emotional conditions also which can impact hair loss. So we need to understand what is there in the case and then accordingly treat it. Yes, homeopathy does help in nutrient absorption, and the most common deficiencies that we see in patients who have a hair loss issue is iron deficiency, vitamin D deficiency, B12 deficiency, folic acid, zinc, and sometimes we also notice magnesium is less in their body. So based on the symptoms and based on the test, we can identify what you are deficient in and accordingly supplement it. But many times if there is a problem with the gut and the gut is not doing the digestive process properly, when we give nutrients you are better, when you stop nutrients you are back to square one. In that condition, homeopathic constitutional treatment can help to improve the bacterial flora inside the intestine so that your absorption of the nutrients can happen better, so that your dependency on supplements for prolonged periods can come down.